All right, welcome back everyone to another session of QuaranSTREAM Answers for COVID-19. Today I'm thrilled to be joined with a number of guests. We have Rachna Sizemore-Heiser. Go ahead, who are you, Rachna?
Hello everybody, I am one of the other at-large school board members along with Abrar and Karen Keys-Kamara, and I'm honored to be here today. Abrar, thank you for having me, and Kimberly, thank you for having me. I'm happy to be here to talk everything schools and more, so thanks.
Great, thank you. And we also have two representatives from the Fairfax County Department of Family Services. We have Patricia Araujo. Go ahead, and who are you, Patty?
Hi, thank you for having us. I am a quality improvement manager with the Self-Sufficiency Division.
Awesome, excellent, thank you. And Allison Lowry. You're muted though. No worries.
I was trying to be good and stay muted. Thank you for having us on. I am Allison Lowry. I'm the program manager for Child Abuse and Neglect Prevention Services.
Excellent, thank you. And as always, folks, I'm one of your at-large members on the Fairfax County School Board, and
I'm Kimberly, and I'm the student representative on the FCPS School Board.
Excellent. So we'll start off, as always, with some updates. We'll take a couple of your questions on academics, specifically FCPS related things, and we'll go into a discussion on the Department of Family Services, what they're offering, and then take your live questions for our representatives here today. So with that, as always, if you want to be reminded of these QuaranSTREAM sessions, you're able to set up notifications for the live streams. You can also text 8 to 81010. You can text @ QuaranSTR, so QuaranSTR, to the number 81010 to get reminders for every session. So with that, in Fairfax County so far, we have 4,407 cases, 750 of which are hospitalized, 306 were new cases just today, and with a total of 189 deaths. So be sure to stay safe, continue to socially isolate, and stay healthy. We want to make sure that we're taking care of one another and recognizing the impacts of covering our faces when we leave and all of that for one another. Exciting news, the state superintendent announced $238.6 million from the CARES Act that will be going to Virginia schools. So we'll look forward to updating the community on that in the budget process that we're having moving forward. As we mentioned for you guys before, some of those numbers we didn't even know, right? And we're TBD on the list, and Rachna will comment on that in just a second here. Because we have a general school board meeting on Thursday for the public. If you're a citizen and you want to make your voice heard on any matter that's going on, be sure to sign up. You can call the school board office at 571-423-1075, or go ahead on the website where we've shown you guys before, full menu, school board, citizen participation, and you're able to sign up. It is first come, first serve, and there are 10 slots. So if you're burning to share something, be sure to tune in Monday, 6 a.m. when the form is open for you to sign up. So with that, Rachna will talk to us a little bit more about what are we discussing and how did we get to the point of what's on our agenda.
Awesome, thank you, Abrar. I just wanted to add, Abrar, thank you for sharing about the citizen participation. That's awesome. I just wanted to add that if, I know there's only 10 slots, so if you can't sign up, you're always welcome to send the school board an email with your thoughts about the budget. And so there are other options for participating, and also call us. If you go to the fcps.edu webpage and click on school board members, you'll find contacts to us individually, or you can email the whole board. So there's, we all want to hear from you, want to hear your budget thoughts. So thank you, Abrar, for sharing about citizen participation.
Absolutely, thanks for that reminder.
Yeah, let me share my screen here. So this is from the presentation. This is up on our board docs. So again, if you click on the school board, fcps.edu, I'll show you here. If you go to fcps.edu, you'll see school board meeting agendas, click on board docs down here, and it'll take you to our board docs page, which is interesting. So if you go to board docs, you click on meetings over here. I want to show people, because I get a lot of questions from people on how do we find information about your upcoming meetings and agendas. So I'm just going to kind of walk you through. So you click on meetings and you'll see May 7th, we have a school board electronic meeting. If you click on that, you'll click on view the agenda. And then over here on your left, you'll see the entire agenda for our school board meeting. And as you scroll down over here, where you see this little symbol of a piece of paper, that's where there's additional information or documents or presentations that are linked to that particular agenda item. So the no change memo, there's a memo there, but the one that I'm going to show you just briefly is this FY 2021 approved budget. If you click on that, you will see up here on the right, it talks a little bit about who's the contact. For us, for example, the main budget contact and the finance contact is Lee Burden, who's our assistant superintendent for Department of Financial Services. Marty Smith, our chief operating officer, and our director, Alice Whittington of Budget Services, are also sort of the three main people who do the deep dive and present the budget. And this is just really a presentation. It's the superintendent's formal presentation of the approved budget. And so I'm going to walk you through a little bit about our budget process to date, and then talk a little bit about the overview of what the budget is and show you the presentation as well. So how the budget works is the superintendent presents to the school board his advertised budget, which we adopted on February 6, 2020. And this initial advertised fiscal year 2021 budget included an request increase of $89.7 million, or 4.2% of the county transfer. And overall, it was a 5.8% increase over the fiscal year 2020 budget. So while that budget was approved at the time, then COVID happened, and there's been a significant change in our economic forecast, as I'm sure many of you are familiar with, after that February 6th approval of the advertised budget. So on February 25th, 2020, the Fairfax County Executive, so this is the county's executive, not school board, presented to the county the fiscal year 2021 advertised budget plan and the change, which we thought were all going forward. And then after COVID happened, we realized that there's going to be some significant differences in the amount of funding that we're anticipating from both the county and the state. So the county executive has a revised budget proposal that he submitted to the board of supervisors, the county board of supervisors, on April 7th. And that reduced the transfer increase. So I want to be clear and say that we're still getting an increase from the county from what we did last year, but instead of an increase of 89 in change, we're getting more of an increase of 7 in change. So that's a big difference from what we anticipated for our advertised budget, but I'm grateful to the county that we're still getting an increase from last year. So because of that change, and I can show you down here, you can see the county transfer is reduced from 82 million from what we anticipated, from the 89 million we anticipated. Our state aid is down 4.8%, which actually is less than we were afraid of. So that's good news. And thank you to our state representatives for taking care of the schools and their changing budget. And our federal number has not changed to 20.8 million. And we actually also received money from Fairfax City. For those who don't know, Fairfax City contracts to Fairfax County to operate the schools. The city operates the buildings and manages the buildings. And so they pay us tuition. And so because the buildings have been closed and so on, we're anticipating a lower amount from Fairfax City. So the total budget difference is 67.3 million less of what we're anticipating than in February. In addition to that, you can see we actually have some expenditure adjustments. So for example, we're saving on utilities with the buildings being closed, about 1.5 million. We're saving on we're reducing STEP and MSA by 75.4 million. And so I'm going to sort of flip over now to the presentation. So this is the summary here, but if you scroll down in board docs, you can actually see right here the budget presentation. So for those of you at home who want to follow along in this really exciting stuff and see what's changing in your schools, you can click on this budget presentation and it'll show you. So anytime we have a school board meeting, whether it's a work session or a public meeting, this is the process by which you can find information. I know it can be confusing. So I'm going to flip over here to the budget presentation that will be getting on Thursday. And this is the superintendent will present to us the fiscal year 2021, just sort of the overview of the approved budget. And then we will have a chance, you can submit your public comments as Abrar just went over, but we'll also have a couple of public hearings on that. And I'll get to that at the end of this presentation. So I kind of talked through this briefly. But our fiscal year 2021 advertised budget, these are sort of the differences in what we're anticipating from what we thought back in February because of COVID and the changed economic forecast. And as you can see, our county, increase, what we anticipated was an increase of 89.7 from last year, which was fantastic. And we are all excited, but we're grateful that they're still increasing what they're giving us by 7.3 million for fiscal year 21. That's the change here. The state estimate, we were estimating a 69.2 million from the state, and we're actually only getting a decrease of 4.8, which is, like I said, less than we were afraid of. So our total numbers from the state that we're getting is 64.4 million. Our federal is actually getting a little bit more based on estimated stimulus based on the General Assembly biennial budget. So that's what the state estimate is. And then based on the estimated stimulus allocations that the state is giving us, which Abrar mentioned at the beginning of this, the funding from the CARES Act, the estimate that we're going to get to Fairfax County is we're guessing about 20.8 million. So 20.8 million adjustments, so 21.3 total. So we had anticipated 20.8. We're anticipating 400,000 more for 21.3 million total in addition from the state. Same Fairfax City, we had anticipated 13.9 million. It's adjusted a little bit lower to 13 million. So our total advertised budget are changed from what we thought in February. We thought it was 172.2, sorry, 172 million, 0.2. It's now 104 million. I do want to make it clear the advertised budget is different from the program budget. The program budget is ongoing programs, and much of the program budget is fixed costs that we can't change. The advertised budget are initiatives on top of the program budget. So that's what we're voting on right now. It can be confusing. So I'm going to kind of show you a little bit of the basic topics or areas that we're spending our additional money on in the advertised budget. And a lot of our focus is going to be on increased enrollment and student populations requiring differentiated instruction. We're actually anticipating potential for increased enrollment, given that people may be moving to Fairfax County for jobs if they've lost employment elsewhere, or there may be some families who have children in private schools and other reasons. And then also, given COVID and what's happened, we understand that our distance learning may end up increasing gaps for some of our more vulnerable students. And so there may be some students who need differentiated instruction when we can go back to school to help them sort of catch up. We also are making sure that our middle schoolers have laptops for next year. And we've seen the importance of having technology for all our students. Currently, only our high schoolers are 1-to-1 for laptops, but starting in the fall, we'll be into their middle school. And so that's where you see the FCPS on. Benefits, textbooks, you can see kind of the amount that we're spending here. Our salaries, we're looking at making sure that we go into our second year of our SIS phase enhancement. So this is salary enhancement for some of our IAs and other paraprofessionals whose salaries have not been caught up to where we want it to be. So we're continuing to make sure we support our classrooms and our support staff in our classroom, because that's really important, especially as we were hoping to try to build to a living wage for our support staff here in Fairfax County. So those are some of the things that we're spending on. I'm going to kind of go down through that. We do anticipate federal stimulus funding, a one-time of $20.8 million of a one-time fund to help with some of this remediation. And Dr. Brabrand will talk more in detail of some of his thoughts as to what he's proposing to spend some of that money on. Technology enhancements, I know, is probably one of them, but also ways of helping some of our students catch up on the learning and remediation and how that may look. Part of the uncertainty right now is we don't know how it's going to be. We don't know when schools will be safe to open up and what that will mean. So, and
none of it is final, right, Rachna? This is all continuing to be conversation depending on the financial situation nationally and statewide. And Dr. Brabrand will be going into depth on it on Thursday.
Exactly. And then we're also, that's a great point, Abrar, that this is just sort of his formal presentation of his proposal. It's not finalized yet. We're also anticipating post-COVID funds about 8.6 million. And he'll go over that in depth. And these are kind of the categories we're really focusing on for our spending. It's achievement to make sure our students can still achieve. It's equity to make sure all of our students will close those gaps. Access, it's social emotional, because we recognize our students are suffering mental health issues as well from being isolated and alone, and sort of workload to make sure our teachers and staff have support that they need in the classrooms. So that's kind of the big topics. And again, Dr. Brabrand will go into this in detail. Again, you can kind of see some of the things that Dr. Brabrand will be presenting to us is a special education review. It's something that we've been wanting in our schools for a long time, is reviewing our special education programs, dropout prevention, because we know a lot of our students, especially with mental health issues and changing finances within families, making sure our students don't drop out is really important. Enhancing our online campus, especially for students who may not be ready to go back to school. Those are a lot of the things that we're looking at: technology, infrastructure, and supports. Behavioral intervention services. We're looking at adding social workers and substance abuse prevention. That's what this is. Again, Dr. Brabrand's proposal. There'll be room for public comment and for board comment as well. So this is sort of what he's talking about. And you'll see more in depth in this on Thursday. And I just want to point out one last thing, which is the timeline moving forward. So when we were after February, when we passed the initial advertised budget, and then we had to revise it based on changing economic circumstances, this is the timeline. So right here, we are on May 7th, the fiscal year 21 approved budget is going to be presented to the school board for new business, and we'll have public comment available there. On May 12th, we'll also hold public hearings. And again, this will all be done virtually, so we can be safe and maintain the governor's order. So virtual public hearings on the budget, and May 13th as a backup date if needed. And then May 14th, we'll have a work session on the budget, taking into account Dr. Brabrand's initial proposal that he's proposing on Thursday, what we hear from the public, and the own work that our school board will do. And then on May 21st, we'll adopt the fiscal year 21 approved budget. So what you're seeing that I just went over briefly may or may not be the final of what we adopt. And there's room to relook at it later on as well. But that's sort of the process going forward. So, Bro, I'm going to turn that back to you and stop sharing my screen. But that's a little bit of what's coming up on Thursday.
Yeah, thank you, Rachna. For those, sometimes the budget can be really complicated, and what's an approved budget? What's an advertised budget? Is this final or not? So really appreciate you kind of walking through that. And Thursday will be when Dr. Brabrand presents this. And then of course, you guys can be in touch if you have further questions and clarification, and we'll be continuing to provide these updates as we move along the budget process in these streams. Great, so we'll just do some quick FCPS updates before going into the most exciting part of today, which is our conversation with the Department of Family Services. So Kimberly, go ahead, please give us some of the food and technology updates in FCPS.
Of course, let me get to it. So as of Friday, May 1st, FCPS has delivered a total of 670,093 meals. The curbside pickup station at Annandale Terrace Elementary School is moving up to pop-up status, which will be serving times from 12 p.m. to 1:30 p.m. And what's it called? So there's also been some pop-up sites and stations have changed their operating times. So
post it on the website.
Yeah, make sure that you guys look on the website to see if a station near you has changed their times, and make sure that you're up to date. And in terms of technology, as of April 30th, there's been 16,905 laptops distributed and 1,129 MiFi devices. And for academics, as most of you know, the quarter ended on Friday the 1st, and grades are set to be seen and viewed on the 7th.
Thank you, Kimberly. And as always, you should expect to receive packets in the mail if you're K through 8 and have not opted out, though we encourage you to do so since it is a hefty budget item. So if you're able to opt out and get electronic packets, please do so. There's a link on the website, and we've shown before, and happy to answer that in the Q&A if someone needs to find that link. Seniors, we know that you're still concerned, and we're still planning on having a conversation about what we can do to find alternative celebrations for you guys. Nothing is off the table still. There is an update though on the website. There has been a page to help seniors solidify post-secondary plans, document your plans, and then also celebrate. So we would encourage you, under coronavirus updates on the fcps.edu website, you'll find under daily updates for May 1st that there is an FCPS class of 2020 website, and you can click on celebrate your plan and see what resources are available to you there. And as promised, we will be doing a stream specifically, including class council officers, to discuss your ideas for graduation and whatnot, and then conversing with Dr. Ivy, our deputy superintendent, who's working on this and plans to come up with some ideas in the near future. With that, Rachna will give us a quick update on special education. You're muted though.
Right. Here, I was trying to be all nice and technologically savvy and, forgot to unmute myself. So thanks for that reminder, Abrar. So I know there's been lots of questions about special education and our TLP plans. I just want update for you guys is that our behavior intervention team will also be having office hours twice a week on Blackboard Collaborative. I believe this is to help out our teachers to and general behavior information as well, and navigating behavioral resources on Blackboards is available too. So it's another resource to help with our teachers and our families at home. I know our TLPs, our temporary learning plans have been being developed by our case managers. So hopefully your case managers have reached out to you and had a conversation with you about these plans. And if you were listening in our work session or school board meetings recently, it was really made clear that FAPE still still exists. And these temporary learning plans are not taking the place of the IEPs. And I also did see, if you're looking at the temporary learning plans, I've got a lot of questions about, do these apply into next year if we have distance learning next year? And if you look on the language of the plan itself, it actually does say at the top, or it should say at the top, this is for this is something for this school year, 2019-2020. So that hopefully should answer your questions. But I highly encourage, on Tuesday night, Dr. Braybrand and Teresa Johnson will be on a live stream with the special education PTA. And I know they'll be going really into depth along answering a lot of questions around temporary learning plans and special education hours. But you should have had your case manager reach out to you if you have received related services. Your speech and language and OT should be reaching out to you, and PTs about signing a waiver. I've gotten some questions about why people have to sign a waiver to get speech and OT services. And a lot of that has to do with actually our licensing requirements for speech and language pathologists and OTs for the state. There's privacy requirements that they're required to maintain. And so the document they're asking you to sign is to recognize that they're going to be maintaining privacy requirements, but this is a virtual environment. So it's really not anything other than them being able to provide services as they need to, and so maintain the requirements of their licensure. So that's one of the reasons why they're doing that. But then that your speech, language, and OT services should continue as well. Again, according to your temporary learning plan and how your SLP and OT reach out to you. So I know it's tough. I know for a lot of our students, it's really tough out there, but if you're having issues with your temporary learning plan, please reach out. We have an ombudsman, FCPS ombudsman, and it's just an email is ombudsman@fcps.edu. There's a special education ombudsman as well who can help navigate some of these issues for you. So if you are having issues, send an email and that hopefully should help you out. So that's kind of what's going on, but I'll turn it back to you.
Thank you, Rachna. Yeah, and we discussed, I think, the previous stream or the one before that we had a presentation in extensive details on the special ed plan broadly for the division, if anyone's interested in how the system itself is handling it in one of our public school board meetings. So with that, Kimberly will give the final update on employees, and then we'll move ahead and we'll keep specific FCPS resources to the end so that we make sure we have a conversation with our guests. So go ahead, Kimberly.
Okay, so the Equity and Cultural Responsive team is starting weekly professional learning series, All Things Equity, where they will use tools, resources, and strategies regarding equity and access for distance learning. The recorded webinars are available on the FCPS website under Employee News. The FCPS Employee Assistance Program, EAP, has webinars on managing anxiety, emotional eating, and tools to cope with the stress. This is available on the EAP COVID-19 page on the intranet for employees.
Thank you so much. So with that, thank you again to our guests, Allison and Patty, who are here to tell us a little bit more about what's available to families in the county. So go ahead and give us a sense of what even is the Department of Family Services. What's the structure? What are some of the things you guys have been working on? And then certainly we'll go into more depth as to the specific resources and programs you guys offer.
All right, I'll start. I wasn't sure which one of us was going to give the overview. So the Department of Family Services has several different divisions. Patty is with the Self-Sufficiency Division, and I'll let her tell you about that. I'm with the Children, Youth, and Families Division, which does things like we have child protective services, we have foster care and adoption, we have our family engagement program and quality assurance, and then we have my program, which is child abuse and neglect prevention. We also have a division called Adult and Aging, which reaches out to the elderly community and helps in cases where there may be some abuse situations going on there. And then we have a domestic and sexual violence services department, which that kind of says what they do. And Patty, who am I missing? Am I missing anybody?
I'm trying to think.
I think those are the big ones.
Yeah.
And did you want us to go ahead, or did you want us to just
Yeah, no,
Hello.
go ahead. I wanted to make sure so folks know, right? We have Fairfax County government, which everyone pays taxes to, and they have a number of departments, right? So they provide services for the community that not everyone even knows about sometimes, right? And one of those departments is Family Services, which has the various subdivisions that you mentioned. So I just wanted to contextualize it for folks. But yes, please go ahead and give us the overview of your own specific programs and what's available.
Okay, great, thanks. So my program does a lot to reach out and support families. That's kind of our where we focus, is trying to build up families and help them be able to not need further interventions from my organization, which is things like Child Protective Services and foster care. So we have some programs for new moms. We've got some partnerships with the schools to try to identify families early on that may be struggling, may be isolated. We have some mentoring programs, things like that. We also have parenting education programs, and that's really where we've tried to, in these times of isolation, really reach out and figure out different ways that we can connect with the community. So our parenting education programs, all their parenting education groups, they're usually in the evenings in person. And so we went virtually very quickly. So those are up and running virtually. Some things we also have for families are, we just started, I guess it's been about a week, we started a parent support line so that parents could call kind of and get in the moment coaching. So your kid's driving you crazy and you need somebody to kind of work through that with, because you're all together in the house 24/7 now when you're not used to that. So this line is intended for that. So right now it's staffed during the day, so 8 to 4:30, but it does have a voicemail. And I don't know, verbally, that number is 703-324-7720. There's also an email address. So if you're in a situation where you can't really talk on the phone, but you want some sort of written response, that might be easier. The email address is buildingstrongerfamilies@fairfaxcounty.gov.
And I'll be sure to edit the description as well of the video so that folks have that resource right there. Thanks.
Awesome. Thank you. We also have started doing virtual parent cafes on Monday evenings from 7:45 to 9:15 p.m. That seemed to be the sweet spot for parents as to when they could log on. But this is really an opportunity for parents to support each other. So you may be able to share with somebody else something that's worked for you and just get moral support. Some of the things we've heard from people who've participated in those have said, you know, now I feel like I'm not alone, like somebody else is going through something similar. So that's been really helpful. If you're interested in that, you can either call that parent support line to get registered, or email that Building Stronger Families email address to get registered. We are currently registering people for the parenting education classes that are going to start in the summer. They're typically a series of weeks, and it's the same people participating, so we can build some camaraderie there. So we are enrolling for our summer classes, which will be starting in June. And again, same number and email if you're interested in something more longer term and based on a curriculum. What things we have been saying to parents and encouraging parents just in the community have been really around taking care of yourself and your own well-being and your own mental health, because I know we all have short fuses, especially, like I said, when we're all together. And if you are struggling, reach out for help. There's also a piece of this that I want to share about the community response. The highest reporter to Child Protective Services is the schools. And so these kids are not being seen in the schools, and there are kids in some tough situations, and school has been their lifeline and their respite. And now they don't have that safe place. So as a community member, as a neighbor, as a parent, as a family member, if you know a family is struggling, either reach out to them or call us for advice if you want to talk through a situation about what should you do. If you do have concerns that a child may be being abused or neglected, I'm going to give the Child Protective Services hotline number as well. That number is staffed 24/7, so it can be the middle of the night and somebody will answer. That number is 703-324-7400. So it would just be looking out for your neighbors and people you know that might be having a tough time.
Thanks, Allison. And if you would comment as well on, what sometimes one of the things that concerns people about calling and reporting, right, is the repercussions on people who may be their friends or neighbors.
Right.
So yeah, maybe a comment a little bit on what the process is after that, or why folks shouldn't worry in that way.
Absolutely. Thank you for bringing that up, because you're right. That is one of the biggest reasons people don't call. You can always call anonymously. You don't have to give your name. You don't even have to give the person's name. Obviously, we can't really do much if we don't know who or where they are. But if you just want to talk through a situation, there are social workers on the phone that can work through that with you. But yes, you can report anonymously.
Thank you, Allison. So yeah, we'll definitely be asking you a little more follow-up questions and hearing from our folks here in the audience who have direct questions. But before that, let's hear from Patty about some of the services that her office offers and what resources are available for families.
Thank you so much. So again, I just wanted to reiterate, right, the Department of Family Services kind of has all these little divisions, but all of it is to support the community. And so my division, and specifically, we work with providing medical assistance, connecting families with financial assistance, food. So if you've heard SNAP or food stamps, if that was what they used to call it a long time ago, we connect people with all those services. So we also have energy assistance. We have employment centers that are currently closed because the county buildings have been closed to the public, but they're doing really cool stuff with what's happening right now. We've got virtual job fairs happening so that people can still get connected and still support them in finding employment. I think the big thing for me that I would want everybody to know is that you can do a lot from home. You can get connected with services from home. I was going to share with you some flyers. Our motto right now is assistance from a distance. So people can apply online. We can do interviews over the phone. So some of the programs that people can apply for will require an interview, and some of them do not. And so you don't even have to leave your house. So you can use your camera on your phone. You can use your computer to download pay stubs and send everything electronically. You can apply online. You can apply over the phone. So really, it's just kind of getting that word out and getting people to understand that it's okay. We want you to stay home. We want you to be safe, but these services are still there for people to apply and access. Now you're on mute.
Yeah. Thank you for pointing that out. Where can they find this? So a family, well, actually, let's start with who qualifies, right? So I know we have, there's SNAP, there's Medicaid, there are a number of resources that you guys offer. So who does this apply to, and where can they find that?
Okay, so a great resource is to go online, go to www.commonhelp.virginia.gov. So that's a great resource because it's everything is in one spot. So it's a great hub. You can learn about what the different programs are. And then if you scroll to the middle of the page, there's a great tool. And that's where I would tell people to go to. And it just says, am I eligible? And so basically you plug in some information about everyone that's in your family, how much money is coming in monthly, what your expenses are. And then what happens is it's a screening tool. So it will reply back and say, it looks like you might be eligible for SNAP. Would you like to apply? And then you can start that process right then and there. So it's a great resource to kind of get in there, because I will tell you that all of the programs have different rules. So it's very possible that someone is eligible for one and not the other. So there's that also. So that's why that tool is kind of all encompassing. And it would be a great resource for people who just wanted to find out a little bit more.
Thank you. And for folks who may not, whether it's language barrier or just not knowing legalese, what are these programs? So you mentioned SNAP is like food stamps, right? There's Medicaid, there's also TANF. I mean, what do these things offer people?
Okay, So let's go through kind of the list of things. So Medicaid is health insurance. So think of it like any health insurance that you would have at a job. The difference is that you're not paying for it. So it's not coming out of your paycheck, but it functions the same in that you have to go to a provider that accepts Medicaid, but it is health insurance. There's varying levels of coverage. So that's one thing that you should know. So that the different, depending on your age, what your family composition is like, if you're single, if you've got little kids, if you're over 65, the rules are going to be different. But then what's also been great to kind of connect people quicker with benefits is that if you apply online through Common Help, and let's say that for whatever reason you're not eligible, it shoots the application automatically to the health insurance marketplace. And so they'll determine eligibility to see if you're eligible there. So you only have to apply once. The same way if you started with the health insurance marketplace and they said, whoa, this person's eligible for Medicaid, they would shoot the application to our division. So that's how the medical assistance works. For food stamps, so that is a monthly supplement that is given to families based on household size, what your expenses are, how much income is coming in. So we look at things like earned and unearned income as well. And so based on all that, then you'll get a little EBT card. So that's what's great. So it used to be called food stamps because it was actually paper. It was that you would hand out. So it was like an actual food stamp. And so a couple years ago, they've changed that and went away from that kind of antiquated way of doing benefits, and now it's on a card. So you get one card and that card is loaded every single month with some, with money for food. So the difference with that is you can only buy food with it, which is different than our cash assistance, our financial assistance programs. With that, you get you can use it to pay your rent, buy diapers, and use it at your discretion. So our financial assistance program for families is the one that you mentioned, TANF. So that stands for Temporary Assistance for Needy Families. But in Fairfax County, we are actually unique in that we offer another program called General Relief, which is for my adults who don't have children and who may be temporarily disabled or in the process of applying for permanent disability. And so that's another component that is unique to Fairfax County. We also have programs in place to support, maybe it's not myself and my own child, but maybe another child that I'm caring for. So that's another support that's there to kind of keep children with someone that they know. We also have the employment and training component. So before COVID, we had 4 employment and resource centers at all of our offices. So each office had its own, and you can go in there and use the equipment. They have resume writing and everything under the sun to help get people connected with work. And we also have the long-term services and support division that's kind of part of Medicaid, which is for some of our families who are in need of those types of services.
Thank you. So for folks, who are watching, our local government really does offer a number of services and support. So you don't have to feel alone and you don't have to feel like things are too tight, because there are some resources out here for you to be helpful. For both of you, if you can comment a little bit on how COVID maybe has expanded some opportunities or how things have changed, so that people know what particularly should come to their attention right now.
Well, I can tell you that on my side of the house, there's a lot happening around making sure that people stay connected with their medical services in particular. So several waivers have come into place saying that, no one is to be discontinued from medical insurance if they were currently receiving it. So that's been nice. We've had SNAP in particular is one of the programs that typically requires an interview. And so the state has waived them. And so we had the option to waive an interview. So it's really important. And I say that because it's really important for those of you who are interested in applying to make sure that you fill out those applications as much and as thoroughly as possible, because it's really going to help kind of move that process along. We, of course, my agency has moved people who typically don't work on the intake side, processing new applications. So we've put kind of everybody, all hands on deck to make sure that not only that we're processing the applications timely, but in the quickest that we can connect people with services, kind of knowing that everyone right now is in a tough spot. And so making sure that we're connecting people as quickly as possible.
Thank you. And Allison?
Yeah, and for us, I talked a little bit about it, but I feel like we've been able to reach more people by going virtually, which was something we'd always talked about, but you know, crisis is a time of opportunity. So when we had to go virtually, we were actually able to do it very quickly. So we have been able to reach out to more people. Some of our social workers are doing virtual home visits, so they're able to still connect with families and still work through situations virtually. Still able to see children, that sort of thing. Our Child Protective Services workers are still going out into the community when they need to. When there's a report of child abuse or neglect, they are going out in person using, you know, precautions and protective equipment and that sort of thing.
Wow, thank you. Thank you for that. I wanted to see here what some of our community questions might be. So folks, go ahead and send in your questions and we can address them. I wanted to also make sure, so Allison, you mentioned the hotline, the number that you guys have for folks to find these resources. Patty, if folks are kind of confused as to where to go, or, you know, with the distinctions of these programs, where the website is, all of that, we'll post this particular link you mentioned. But is there a line or someone that they can reach to gain more clarity?
They can call anytime. They can call 703-324-7500. And what I'm going to do is I'm going to actually send you those assistance from a distance flyers. I have them in 5 different languages. And so it has all of the information right there.
Yeah.
Thank you so much. That's excellent.
Sure.
Yeah, that's what I was going to ask. Actually, I'm glad you asked that about, you know, an easy number for somebody to call and they can kind of get routed to the right person.
Mm-hmm.
You know, and I'm assuming you probably work with the CSB board as well in terms of the mental health intake and things on that side of it for anyone who may need help.
Mm-hmm.
You know,
Yeah,
so.
you've been a long-time member of that, Rachna, right? Are you still on it this year?
No. I resigned from the CSB board when I got on the school board. So yeah, I'm not on it anymore. But I do know that the schools work very closely hand in hand with the CSB as well for intake for students having mental health issues. So it's nice to know that there's sort of one phone number for people to be able to access resources and things like that. Do you find, I just out of curiosity, do you find, I think it's great to hear that, you know, going virtually, you're actually able to reach more people in some ways, which is really nice. But do you find it harder to reach maybe populations, like efforts to kind of get outreach to populations that may not have as much access to be able to reach you virtually, right? Like, can you talk a little bit about how that looks now or how we can help with that?
Yeah, that's definitely an issue for us. Fortunately, the folks that we were already working with, most of them did have access to technology. We've had several donors come forward and offer to do refurbished devices for people. The issue is then the Wi-Fi access and all that kind of stuff. So there's some stuff to work through there. Language capacity is also a challenge. We have a language line that we use in normal times as well. So we've been tapping into that during the situation as well. But in large meetings, we could have one translator or several different translators for different languages. That's much harder to do in a virtual setting. So equity is definitely a concern for us and something that we continue to look at as we work through this.
It's always hard in situations like this. The people who often need it the most, right, have the hardest time finding it. So anyway, we can help to get that information out. You know, I'm happy to do that. I'm sure Abrar is as well. So, you know.
Yeah, absolutely. We can add these resources to our newsletters and certainly make sure they're posted on our pages.
Yeah, absolutely. If you want to forward me the email too, I'll make sure I get it out too. So thank you.
Absolutely.
Yeah.
So another thing I just wanted to bring up, because listening to Allison, that got me thinking. So that's another resource for us. So I would want people to know that if you don't speak English and you need a translation, we offer that. So we actually have a vendor that we use. And so that wouldn't be a barrier. If you are not computer savvy and you're like, oh, I don't want to apply online, we can do it over the phone. And so I have some numbers for you that I'll shoot out to you later. But if you're looking to just apply for health insurance, the number is 1-855-242-8282. And if you want to apply for everything, That's 1-855-635-4370. And there are call center representatives at those numbers available in Spanish as well right now.
Oh, and Patty, I'm glad you said that, because our parenting classes are offered. We have some in English, and then we also have some in Spanish. So we have a virtual class that is all done in Spanish.
That's wonderful to hear. I know that we try to post a couple of things in Spanish here and there, and I'll try to see if we can put a tidbit at the end of this to tell people that these are available in Spanish as well. We do have a question from Ashley here. So what can I do if one of my neighbors worries me in terms of family services, but I can't knock on their door to ask for obvious reasons?
So that's a great question. And without knowing more of the situation, it's kind of hard. But if you're worried about the family having resources, maybe ask them if they need some help. If you're worried about, you're seeing the kids with bruises or something like that, I would go ahead and call the Child Protective Services hotline. But if you're more worried about the family not having resources or not having things that they need, reaching out to them and doing it in a way that allows them to maintain their dignity. They may not want to tell you they're struggling, but just knowing that you're offering to help or offering to get them connected to resources, even if you're not the one getting them help, but connecting them to benefits like Patty was talking about or something like that.
I would just add, conversation is a great and easy way to kind of ease into it. I mean, you could totally use this as an opportunity and say, hey, I learned about food stamps and financial assistance in the county from this live stream. Have you heard about it? Because it could be a situation where somebody just doesn't know that those services are out there, or that they're thinking that, somebody's going to see me walk into an office. So having that capability to apply online and over the phone without anybody seeing me is really great, because I think that it maintains that that piece that sometimes people worry about.
Mm-hmm.
Thank you. What are the signs too, Allison? I don't know if you want to talk a little bit about how folks can detect some of these things in ways they may not have paid attention to before.
Sure. And it's really hard right now with people really being at home. You're not, even extended family members aren't seeing each other, but, some signs to look out for obviously are the obvious physical signs, but things like kids not being interested anymore in things that they were really passionate about. So if they loved Pokemon, all of a sudden, that doesn't even spark their interest. Staying connected with your kids in your life through video chat, just letting them know that you're there and that you're there to talk to them if they need it. I think Patty brought up a great point about simple conversations, just asking people how they're doing, and that includes kids, asking kids how they're doing.
Yeah, no, thank you. I know oftentimes we get questions from the community about how they can help, what they can do, and even, just contacting your neighbors, asking about people, seeing how they're doing, and then maybe suggesting resources if they're beneficial to them could be a huge help during this time. So I appreciate that comment. Let's see here. Rachna and Kimberly, feel free to jump in if you have a specific question. I'm gonna turn to some of the audience questions right now. So someone's asking, okay, what are the numbers we should call? Just reiterating, I will be posting in the description of the video right after we're done with the live stream, the detailed information, and then following up with some of the flyers. I think that Patty and Allison will have materials that they're going to share. So we'll be sure that that's available to you. So what are some of the services and resources that are not necessarily just specific to your office that you may be aware of that folks can pay attention to? Sometimes, folks don't even realize that local government offers a number of these opportunities, but maybe if you can help, mention some of the things that you're aware of, and then we'll take a different question.
We've got, we have a lot of food banks in the area. There's a great resource, Virginia 211. that is kind of statewide, and it's a great place because you can just log in and then type in one word like rent and then a zip code, and it will pop up, you know, all of the resources. Same thing with food. So it's kind of like a one-stop shop. The other thing is, you know, the farmers markets. A lot of times that's a great way to, if you are receiving SNAP, to kind of literally double your dollars, because they do a match system there. So that's kind of some savvy shopping. So, I mean, that's a really great resource. And then, you know, logging into, visiting our county pages, I think is a great place to kind of start and see what some of the other divisions do and learn about it, because there's a lot that's happening that is based around what can we do to help support families. There's a lot of going on in the divisions around kind of preventative. So, and I think Allison brought that up. And so I would just kind of, we don't have anything else to do, right? So spend some time on fairfaxcounty.gov.
Yeah, I think the food banks are a great one. And for folks that are having transportation challenges, they're trying to figure out a way to deliver food that, you know, you would normally have to go to the food bank to get. So there's a group across the county that involves all of the nonprofits as well as county staff, really looking at these different things like financial needs, food access. There's one on youth programming. So what does the summer look like? What do we do about summer camps? What are we doing about after school time or even in school time? Health access, those sorts of things. So that is a group so that different community providers can be talking to each other, so that we're not all doing the same thing or trying to meet the same need, that we're leaning on each other and referring to each other so that we know what's available and what's going on.
Yeah, no, thank you guys for answering that. And the key message really, guys, is you are not alone. You know, as a community, there are resources out there, and it doesn't have to mean that you have a problem that you have to seek out any of these offices, right? Especially, you know, Allison, you were mentioning some of these family support groups and just gaining, you know, best practices as what one can do, or even just expressing kind of frustration and stress that everyone is experiencing. So sometimes there's stigma to this and feeling that you have to reach out for help, or the government has to kind of come in and support you. It doesn't have to necessarily be that way. Really, it's us coming together and facilitating resources that your taxpayer dollars are paying for anyway. So, you know, to kind of take advantage of that. Kimberly has a question for us. So go ahead, Kimberly.
Yeah, I'm just wanting to ask in terms of like students and children and such. Often, well, for me at least, what I've seen, I grew up in the Lee Pyramid. A lot of our students are immigrant students with parents who may not speak the language, who aren't familiar with this whole infrastructure of services. How do you suggest that we, as like children of immigrants and basically people who aren't exactly familiar with the system, to try to kind of introduce them to these services that they may not be familiar with?
Well, I think that this is a great start, right? If we could start having these conversations more often, that would definitely be a wonderful place to start, because again, that conversation is really that opportunity to learn and tell you kind of what the ins and outs are. You know, I think the schools do have some information. I know that we do a lot of outreach. And so that's one of the ways to kind of learn about what people can get connected with in my division. We have outreach workers that, you know, before COVID would go to, you know, back to school night. They would go to health fairs, that kind of stuff at the health department, making sure that, you know, people aren't there and don't realize that, hey, I'm eligible for Medicaid. You know, this is not, I don't need this resource when there's this. That go to the food banks. And so that, you know, that's one of the things that before COVID, that quite honestly, we were looking at how can we do better at doing a little bit better job with outreach and connecting everybody. I only had 2 outreach workers, so that was the first problem. But
public resources are always tight. Yeah. Allison, did you want to step in there?
I think Patty covered it. I mean, outreach is we're constantly trying. We're going to the back to school fairs. Well, we were those sorts of things, but I think the schools are very well connected, and we try to partner with them a lot in terms of either having a physical presence or even having a virtual presence. We've been also working a lot with the Parent Resource Center at the schools. They have wonderful resources there too. So
yeah. Kimberly, did you want to say something?
Oh no, thank you for answering. That was really helpful. And it's nice to know that you guys are actively trying to get more outreach. I know that's a super tough thing, and hopefully with time and after this whole situation, we'll be able to push that more.
Yeah, just wondering.
Go ahead.
Yeah, just, I mean, like outreach is always tough, especially with limited resources and limited people, right? And I mean, I know there's community organizations and faith organizations that work on some of these issues too. I'm just wondering if there's outreach, through that, sometimes I know that churches aren't meeting now, or faith organizations aren't necessarily meeting in person, but there's still live meetings and reaching out to. I'm just wondering if that's an area to tap into in terms of. I'm always worried about the people who don't know how to even start looking, right? Like. Is that an area to tap into?
Right.
Yeah, one of the nice things that we've been able to do is start to look at how we can use data better. So if I know that in this zip code, I have X amount of people that don't have health insurance, well, then that's where I need to go. And so that was kind of before COVID, that was kind of our plan to start really looking at the vulnerable populations. And so that's been kind of something that is on the back burner right now, but we're still thinking about that and what can we do with that information, and making sure that right now, being in a health emergency, that I can, help to connect people with medical insurance.
That's a great way. We used to, when I was on the CSB board, they used to present us with the hot spots around the county, right, in terms of the service uses and things like that. And it really helped inform where to sort of focus efforts on. So I'm glad to know that you guys are doing sort of similar work there. That's great.
Yeah, no, thank you for pointing that out, Rachna, and Kimberly for the question. I'm curious as to what the partnership with schools looks like now that things have switched over. So you can't go physically, right, to visit schools, and what has that outreach looked like right now?
So for us, we've stayed connected to the school social workers. The school social workers are still doing consultations with families and with youth who are interested, and so they're still connected in some ways. So we've been staying in contact with them as well. And back to the question about the faith community, Rachna, that's a great point. And we are connected to a group called Faith Communities in Action, and I can't remember how many people are on it, but it's a lot. It's a lot, because that is a way that people reach out for help without thinking, oh, I'll go to the government for help, because I don't think many people want to do that. So that is kind of a faith communities generally have a good sense of what's going on in their communities, what their congregations need. So they have a good sense of the pulse.
And I think sometimes it's easier for people, to your point, to get help from the faith community than to feel like it's that dignity sometimes issue.
Absolutely.
People feel like it's a more dignified way to seek help. Yeah, and it's sad that people think that way because they shouldn't, but I think that's still there sometimes in our society. So it's great to hear.
Yeah, and it feels more accessible,
Yeah, it feels more personal, I think. Like,
yeah,
you're asking, I don't know, that's just, so that's great to hear. Thank you.
Sure.
Yeah, absolutely. I mean, some faith communities have really stepped up. I know one of the mosques that I frequent has been serving, thousands of meals. If folks need that kind of resource, there's dinner for the next at least 20 days, because it is Ramadan and everyone's fasting. So they're providing that. And I'm sure that, through the partnerships with Faith in Action that you mentioned, that those are some of the opportunities people have. Is there a place actually where folks can find all those resources, Allison? I don't know if all the faith, whether it's faith or other partnerships that have been providing services, resources, food. I don't want to put you on the spot here if that's something add later.
That's a great question. I'm actually not sure, but I'll look into that and get it to you so you can include that in your newsletter.
Cool, thank you. Let me take a look here at some of the questions. Kimberly and Rashna, feel free to jump in as well if you have questions. Yeah, so building on this, so I did want to touch on mental health. I know that was a question that we received last time that we weren't able to address. I have a number of resources here I'd love to mention. And then if you guys maybe on your side of things, comment on any of the changes you've seen, maybe, you know, before COVID, not just in what resources are offered, but what you've seen from the community, you know, what's been the reality on the ground of what folks have been experiencing and the challenges they've been going through. So I'll mention a couple of these resources. So I know on the school system side, you know, as we've mentioned before, if you go to the FCPS website under FAQ, mental health, you'll see a form that you can fill out for a 30-minute consultation and support from school psychologists. There's Crisis Link, of course, as always, 703-527-4077. I think actually one of you may have mentioned this earlier. And then there will also be, there's another hotline specifically for domestic violence, which I think Allison probably is under your purview, 1-800-799-7233. And for the deaf and hard of hearing, 1-800-787-3224. And then in addition, there's a text line for Crisis Link. You can text "need help" to 85511. And then finally, the Mental Health Services Administration has a disaster distress hotline, because one of the things that, you know, we're hearing from folks is that this is a traumatic time or a stressful time for many people because of the change that's involved. You know, human beings and adapting to change can be tough sometimes. And so even for the average person, 1-800-985-5990, anonymous multilingual services for the most part here that folks can access. So yeah, from your perspective, what has been the sense working with families and, you know, providing these services on the ground with COVID?
I never know who's going to start.
I know, right? I'm like, you go, Allison.
We're seeing, and this has been in the news as well, increased domestic violence, lots of families having additional stressors. That's a risk factor for both domestic violence and child abuse. So we know that as things layer on, so you've got the fear of getting COVID, you've got potential job loss, you've got economic situations, you've got, like I said, you're together now all of the time when you aren't used to that. So lots of stressors piling up. So some of the things that we're seeing are in domestic violence and family violence. Getting a lot of requests for food, assistance with food, assistance with rent, just, you know, your basic needs assessment kind of things are coming up.
Yeah, I was going to say that we've seen, of course, we saw an uptake in the applications. So we have seen an increase in applications for assistance. And so luckily, you know, with the stimulus checks coming and a lot of unemployment beginning, we've seen that kind of like level off. So it seems like maybe people are getting the assistance that they need. But, you know, a great resource is the Fairfax County Department of Family Services Facebook page. They actually do a great job of just posting stuff that is just kind of out there as information. And so I would definitely take a look there, because there's a lot around, you know, mental health and kind of staying healthy now that we're all on lockdown, and really kind of self-care and caring for your people also. So that's a great resource. They're doing a great job of using Facebook as one platform to get information out there.
Thank you. You know, we talked a little bit about access issues related to language and information barriers. Have you guys, have there been efforts maybe, or there are resources out there for folks who physically may not be able to access some of this? So whether that's seniors or folks with disability, we've heard obviously of great work on the community level of neighbors buying groceries for their fellow neighbors who can't physically go out. Or maybe even people with COVID or with any kind of illness who can't, you know, are not as mobile. So wanted to see if you guys had some thoughts or know of resources for people in that situation.
You know, for us, we have, we're lucky. We were able to we had a lot of things already in place that made it so that you didn't physically have to come into the office. And so it was helpful because it was already there. Where we are now is I want more people to know that, you know, you don't have to mail it in, because I don't even want you to go to the post office. You can take a picture with your phone and then send it electronically. So we've been lucky in that we had a lot of these things already in place. Being able to call and apply over the phone was great. And that's also something that has already kind of been in place, because that speaks to people who maybe don't have a computer, or don't know how to use a computer. So having that kind of already in place has been really valuable for us, because we haven't had to make all those adjustments right now.
Yeah, I was just going to look up because I don't know it off the top of my head. Oh, there it is. For basic needs help, if people need something, the coordinated services planning. I don't know if you guys have talked about that on here or not, but that they may be a great group to get on one of your QuaranSTREAMs. Their number is 703-222-0880. And I always refer to it as the 222 number. And I didn't know what the other 4 digits were, so I had to look it up real quick. But they will definitely be able to help help people kind of work through what their needs are. And I know they're very well connected with Patty's group too. So that's a great resource, is coordinated services planning.
What's that number again? It was 703-222. I didn't catch
0880.
Thank you.
Sure.
Those are great resources.
Yeah, absolutely. Do you mind, just for folks who may not know what that necessarily means or what that offers, do you mind commenting just real quick on what they're there for?
They're really there if you're out of food, your rent is due and you don't know what to do. You don't have medical insurance, you don't have, anything that is impeding your ability to meet your basic needs. So food, shelter, what are other basic needs? Food, shelter, clothing, that sort of thing.
Thank you. Great. Rachna and Kimberly, if you don't have any other questions, go ahead. Rachna, did you want to?
No, I was just popping back on to say,
Okay.
yeah.
I was going to pose the final question, perhaps for everyone who wants to chime in. A final message of hope. So we're in this situation. It's unclear what's happening. I don't know if you guys even have thoughts on what the future planning is looking like. I know on the school board, and we're in conversation with the local board of supervisors to figure out what's happening, with guidance from the state as to what closures are going to look like. Obviously, there is talk now about potentially resuming business, but then with the chance of second wave, if that happens, so there's just a lot of uncertainty right now. So what would be your message of hope for the community moving ahead from where you're at?
Wow. Well, we're all in this together. And I did hear something or read something recently that said we're not all in the same boat, but we're all in the same storm. And that really resonated with me, is because we're all in this in different situations, but we're all in the same storm. And interestingly, next week is known as Resilience Week, for when you're thinking about trauma and being resilient. And I think, getting through this, we will be stronger as a community. And yeah, that's my hope.
I would agree with Allison. I think that's a great message. I think for us, we just want to make sure that that people know that we're here for them, and that we're working hard. We have a lot of staff who are now teachers and workers, and living with everyone in their home, but that our residents are our priority, and that we are working hard to make sure that they are staying connected with services, and that we are doing it in a manner that is timely, so that people can take care of each other.
Rachna, Kimberly, you want to say something?
I think that's a great question. And I said this early on in one of my early newsletters, the only kind of sign of hope that I see is I see out there that there's families that are, when I go for my neighborhood walks, are, walking with their young children and laughing and swinging and sort of slowing down in some ways in life. And that's really great to see. And like on Saturdays, yesterday, when the weather was beautiful and we went for a long family walk, just walking through the neighborhood and seeing the number of people out on bikes or, social distancing, of course, but, out and enjoying the sunshine. And I think that is nice to see. And I do think about the families who can't do that, the ones who still have to go to work and their kids are home. And I love that phrase, we're all in the same storm, but not in the same boat. I think that's really, really wise and indicative, right? So I do recognize that, but, when you're looking at hope, you look at, I hear from some families and their kids are missing their friends, but some families say, you know what, this has been great for my kid to step away from the pressure cooker that is Fairfax County schools sometimes and just, take a little break. And I think there's been conversations sort of nationwide among school leaders about our standardized testing and whether that's the best thing for our students' mental health and whether we really need that, to have the accountability. And so I think it's starting a conversation that I think it's been long overdue about really looking at our school system as to, is this the best way to educate and do we need to rethink things? And so I think, not to say this good that comes out of something that where this many people are ill or losing, their lives or losing their jobs and all that stuff. But I do think there's hope in us pausing to say this fast, crazy pace we've been on, maybe there's some value in coming off that for a minute. So, if you're looking for some hope, I think that's where it might be.
I think with
Kimberly, close us out.
I guess to wrap up, I don't want to sound like a broken record because I say it all the time, but it's really this whole thing is super tough, and I think Rachna and Allison and Patty, they all said it wonderfully that even though this is really a terrible time, we're all going to come out of this like stronger, and it's going to make us more unified as a community. And that I also want to make sure that everyone's still reaching out to people and still calling people. And sometimes a call is better than a text because it's nice to hear people's voices and to stay safe, because I think, what's his name? The one that was with us last time, the Secretary of Education, he said before that even though like everything that can heal, the economy can heal, except we can't bring back lives that were lost in this situation. So making sure that we're staying safe and that we are making sure that as many lives are not lost as possible.
Absolutely. Thank you all so much for tuning in. We will be posting these resources, so stay tuned. Next week, we do have somebody from the Board of Education. The director will be with us for the live stream, so tune in and ask your questions then. I did want to make sure I said the message for folks in Spanish. So las personas que necesitan ayuda en español pueden acceder a todos estos recursos en los números del teléfono que se publicarán también después del live stream. Muchas gracias, and thank you guys again. We're trying to make this accessible. Really, folks, if you have people who, your neighbors who may not be able to access some of these resources because of physical barriers, language, know-how, we want to, as some of us public officials and as some of us who are working diligently every day to provide these services, be in touch and we'll do our best to make sure that you can access what you need. Thank you all again for tuning in. So until next time, today is Sunday, so Thursday, 7 p.m. Tune in. We're losing track of time here with this with the situation. But anyways, until Thursday, thank you guys so much.
Bye.